Hello, everyone, and welcome back to Justice Rounds with Dr. Jimmell. I am your host, Dr. Jimmell, and I want to say a special shout out to my Justice League. Thank you, Justice League, for being my faithful subscribers and listeners. If you're not aware, this is Justice Rounds with Dr. Jimmell. This is the space where we confront and dispel myths, defend families, and demand justice for those whose voices are too often ignored. I want to sincerely thank my Justice League for rocking with me, and this is the 11th episode. This week is especially meaningful. Across the nation and around the world, we just concluded Obesity Care Week 2026, a global awareness campaign taking place March 2nd through March 6th. This year's theme was simple but powerful: commit to care. That commitment matters because obesity is still one of the most stigmatized chronic diseases in medicine. Despite decades of science, too many people are still told to just try harder, blamed for their biology, or denied access to evidence based care. Today on Justice Rounds, we're going to dispel dangerous myths about obesity. We're going to defend families navigating this disease and demand justice in how obesity is treated in our healthcare system. So let's dive in because obesity is not a failure of willpower. It is a chronic, complex, relapsing disease, and people living with it deserve care, not criticism. So I usually like to start out my episodes with some simple definitions so that we can level set and make sure that everybody's on the same page. So before we go any further, let's do that and make sure that everybody understands what these terms really mean. So the first one is body mass index, or BMI. BMI is a number based on your height and your weight. It is only a screening tool, though, and it's not a full picture of someone's health. However, we use it widely because it's easy to calculate. There has been some intense debate recently on whether this is the best measure to use at all, but we're still using it as this is really all we have right now. There are other ways that you can assess body fat. And there are other things that you can take into consideration, like waist circumference. Um, but BMI remains to be the easiest way to screen if someone is holding excess body weight. So, obesity, it is a long term health condition. It happens when the body has too much body fat in a way that can cause the body harm, in a way that can cause your in a way that can cause harm to your health. Obesity is a complex disease and it is affected by things like genes, hormones, medicines, stress, where you live, whether you have access to healthy food, and whether you have access to health care. In terms of BMI, obesity is classified as a BMI over 30. It is further broken down into classes 1, 2, and 3. Class 3 is a BMI greater than 40, and it is also termed severe obesity. In children, BMI is determined by weight percentiles as referenced on a child's growth chart. These curves should be monitored over time. Obesity in children is a BMI that is greater than the 95th percentile, and severe obesity is 120th percent of the 95th percentile or higher, or an absolute BMI of 35 or higher. So basically, what that means is when you go to your pediatrician or other healthcare provider, they usually, during a well child check, show you your child's growth charts. And if they do not do that, then you should request it. And basically, they can determine from where your child's specific dot is on that curve whether they fall in a category of being underweight, which is less than 5th percentile. Normal weight is 5th to 85th percentile. Overweight is 85th to 95th percentile. And obesity is over the 95th percentile. And then there are extended growth curves because of the prevalence of childhood obesity, where we can go up even further to see if your child is at the 120% of the 95th percentiles, or even if they're at the 140th percent of the 95th percentile. So those are also things that you can see on those extended growth charts. So BMI is not used in children less than 2 years old. That is weight for length, and there are special growth charts for those to be utilized as well. So severe obesity is a more serious form of obesity that can increase health risk. People with severe obesity often need stronger medical treatments, access to medicines or surgery, and not just advice to try harder. Weight stigma. Weight stigma is when people are treated badly because of their body size. This can include teasing, blaming, judging, or not being taken seriously. Weight stigma can hurt people's feelings, but more importantly, it may hurt their health. Weight bias in healthcare. This term is a phrase that talks about what can happen when doctors or nurses or anyone in the healthcare field make assumptions about a patient because of their weight. It can lead to people not getting the care that they need, or it can lead to those people avoiding doctors in the healthcare system altogether. So let's talk about obesity statistics, the reality, obesity by the numbers. Let's start with the facts because justice begins with the truth. Let's talk about some national statistics. According to the CDC, more than 40% of U.S. adults are living with obesity. That translates to 107 million adults in the United States. Nearly 1 in 5 children and adolescents ages 2 to 19, which is about 21%, have obesity, and there are higher rates in Black and Hispanic children and families with lower income. Severe obesity, remember, is a BMI greater than 40, and in children greater than the 120th percent of the 95th percentile. Severe obesity affects almost 10% of adults and 7% of children. That means this disease touches nearly every family in this country. All right, so for my South Carolina folks, which is where I live, let's delve into some South Carolina statistics. Here at home, the numbers are even more sobering. Approximately 36% of South Carolina adults have obesity. About 18% of children ages 6 to 17 in South Carolina are living with obesity, and we are ranked 10th for childhood obesity in the United States and DC. Nearly 4 in 10 public school students are overweight or obese. These are not isolated individuals. These are parents, children, grandchildren, grandparents, teachers, pastors, and healthcare workers, and everyone in between. And yet, despite these numbers, many people still struggle to receive appropriate, compassionate, non-judgmental care. I would like to take a time to share my personal story and how I ended up um, starting to work in obesity medicine, um, and eventually to get board certified um, in obesity medicine. So, as I've shared in a previous podcast episode, episode 3, my brother Leonard lived with obesity, and he ultimately died from its complications. And loving him as his little sister taught me more than any textbook ever could. I watched my brother try. I mean, really try. I saw the diets, the effort, the hope, and the disappointment when it didn't work. I saw how quickly people judged him, how they talked about his body like it defined who he was. As a doctor, I know the science now, but I didn't always. To be quite honest, I wasn't taught anything about the science behind the chronic disease of obesity when I was in medical school. It was not until I attended the Blackburn course at Harvard University in 2019 did I start to fundamentally understand the chronic disease that is obesity. After I concluded the first morning session at this course, I sat in my chair and cried. I realized in that moment that that lectures and browbeating my brother wasn't going to help him, and it didn't help him. I realized that this was a disease, a chronic disease, just like diabetes and hypertension, and that all I needed to do and all doctors needed to do was to learn more about the disease and treat our patients better. So when I speak up about obesity, I'm thinking about my brother Leonard. When I push back on shame, I'm thinking about my brother Leonard. When I demand better care, it's because people like my brother and my mother deserved better. Sadly, they are both gone now from complications of obesity. But there are millions of people with this disease, and their lives can change for the better right now. Dispelling common myths about obesity. So, this is my favorite part of the podcast. If you've been with me through these 11 episodes, I'm going to dismantle some of the most harmful myths standing in the way of justice in obesity care. Myth number 1: obesity is a personal failure. Truth: obesity is driven by genetics, hormones, metabolism, environment, medications, trauma, and social drivers of health. No one chooses a chronic disease. No one wakes up in the morning and say, I want to have obesity today. That just doesn't happen. Myth number 2: people with obesity are lazy or unmotivated. Truth: many patients with obesity have tried more and failed more than people will ever know. Diets, programs, medication, shame based advice. Effort is not the issue, biology is. Myth number 3: weight loss is just eat less and move more. This is what we learned. That's the basis of what I learned in medical school about weight loss and how simplistic and just really a misunderstanding of the disease process itself. But how many people still hear that message today when they try to get help from the healthcare system? I bet people with obesity hear that quote more than they ever would like to hear it. Eat less and move more. So, you know, I my heart goes out, and I hope people, especially in the healthcare system, will not use this, um, when they're speaking with people with obesity. I mean, I guess you could use it, but also realize that it's more than that. So that was a whole commentary, but truth. If that were true, we would not see relapse rates comparable to other chronic diseases. Obesity involves adaptive metabolic responses that fight weight loss and promote weight regain. Myth number 4: children will grow out of it. Truth is, childhood obesity strongly predicts adult obesity and chronic disease. So early, supportive intervention matters. Stigma is not treatment, shame is not medicine, and myths cost lives. Defending families living with obesity. To the families listening today, I see you. To anyone listening today with the chronic disease of obesity, I see you. I see parents blamed for their child's weight. I see children bullied in schools and ignored in exam rooms. I see caregivers navigating food insecurity, unsafe neighborhoods, and limited access to care. Defending families mean removing blame, centering education, providing resources without judgment. Here are some resources that you and your family can use if you or someone you know has the chronic disease of obesity. There are primary care teams that are trained in obesity medicine. That is one of the board certifications that I have, along with pediatrics. So there are some board certified obesity medicine physicians out there, but I also encourage you to partner with your own primary care team. But I also would also recommend that you advocate for yourself. And if you're not getting the treatment and the care that you think you deserve, that you find someone else that would listen to you and treat you with compassion and non judgmental care. There are registered dietitians who could help you, who practice evidence based care. There are good counselors, so behavioral health professionals familiar with weight stigma that can help you. There are community programs that promote movement and not punishment, and there are school based wellness and nutrition initiatives for our children. You can also look at Obesity Action Coalition's website, which is www.obesityaction.org. Or you could also look at the Stop Obesity Alliance. STOP stands for Strategies to Overcome and Prevent Obesity Alliance. And that website is stop.publichealth.gwu.edu. Families families deserve support systems, not surveillance. Treatment options. Obesity deserves real medicine. Obesity is treatable, and treatment should be individualized. Lifestyle based therapy, nutrition, movement, sleep, stress management, and behavioral support are foundational, but they are not sufficient alone for many patients with obesity. That is when we go into our toolbox and pull out anti obesity medicines. These medicines are FDA approved for weight loss. They were originally discovered and utilized in the diabetes space. But then they realized that not only were these patients' blood sugars under better control, but they were losing weight. And that is when the indication for weight loss was sought by these pharmaceutical companies. There are now several medicines out. I know everyone knows the Ozempic, but there are many other ones now, including Wegovy, Mounjaro, and Zepbound. These medicines include GLPs or glucose-like peptide 1 or combinations of GLP and GIP, which stands for glucose-dependent insulotropic polypeptides. These two are hormones that our body produces and help improve metabolic health, like improve diabetes and decrease risk of heart attacks and stroke. It also reduces hunger and cravings, and also reduces the reward people can feel from food. And it also supports long term weight management. In late 2025, 1 in 8 adults report taking one of these medicines. These are medical treatments, not shortcuts. Now, I will stop here briefly to just talk about compounded medicines. I would just say the caveat is that these medicines are not FDA approved. And so sometimes you don't know what they're putting in the medicines. And sometimes you don't know whether those medicines will react with other medicines that you're taking. So I would just caution people from using um, um, compounded versions of these medicines that are not from reliable pharmacies. And so I'm not just, I just don't want people to think that they're all bad, but I just do want you to know that, that is the risk you take with a compounded medicine. You're not guaranteed that it is the exact compound that is FDA approved. So just make sure that you are aware of that you're educated about that, and to make sure that if you are having any side effects, and that goes with the FDA approved medicines as well, that you notify your healthcare provider. All right, metabolic and bariatric surgery. Surgery is one of the most effective long term treatments for severe obesity. It is shown to improve or resolve diabetes, high blood pressure, sleep apnea, and many, many more. Life saving for many patients based on data through 2023, approximately 270,000 to 280,000 procedures have been done annually. These numbers may be declining in recent years because of the improvement in the weight loss medicines. Only 1% of Americans who qualify for surgery based on criteria receive it, according to experts in the field in 2025 publications. So, surgery is not giving up, it is evidence based care. Demanding justice in obesity care. This is where Justice Round draws a line. Justice means recognizing obesity as a chronic, complex disease, ending weight bias in healthcare, ensuring insurance coverage for medications and surgery, training clinicians to deliver compassionate, non judgmental care, including patients' lived experiences in policy decisions. No one should be denied care because of their body size. No child should internalize shame as a diagnosis. No patient should have to prove they tried hard enough to deserve treatment. I commit to care. As we close today, I want to return to this year's Obesity Care Week theme. I commit to care. That commitment belongs to clinicians who choose compassion, policymakers who choose science, families who choose advocacy, and communities who choose dignity over stigma. On Justice Rounds with Dr. Jimmell, we will continue to dispel myths, defend families, and demand justice, because health equity includes obesity care. Thank you, Justice League, for listening to me today. If by chance you aren't a part of the Justice League, please subscribe to my YouTube channel, Justice Rounds with Dr. Jimmell, or you can find me on any place where you can find your podcast. Please like and share this episode with anyone you think needs to hear it. Until next time, commit to care, commit to justice, and commit to seeing people, not just numbers.
I am somebody. I am somebody. Respect me. Protect me. Never neglect me. I am somebody. Nobody will save us from us, for us, but us. I may be unskilled, but I am somebody. In my mind can conceive it, and my heart can believe it. I know I can achieve it. I am somebody. I am God's child. Red and yellow, black and white, we're all precious in God's sight. Stand up, push on, stand up, push on. What time is it? What time is it? What time is it? I am somebody. I am somebody. So if you